Hello and welcome to a brand new episode of your show, Medical Talk. I'm Dr. Mohammad Al-Mehteb. Now, pharmacy plays a crucial role in our healthcare system by providing access to safe and effective medications. The role of pharmacists in ensuring safe and effective use of medications helps to improve patient outcomes and prevent medication-related problems. Pharmaceutical discoveries and innovations have revolutionized modern medicine and greatly improved the quality of life for millions of people. From antibiotics to vaccines, from pain relievers to cancer treatment, the pharmaceutical industry has made countless contributions to human health, and the development of new and improved drugs is an ongoing process, driven by the latest scientific research and advancement in technology. Meanwhile, there are many people have been misusing medications, unfortunately, which could lead to a negative and unexpected outcomes. It is always important to consult your physician and pharmacist whenever you decide to use a certain medication. Therefore, in today's episode, we are glad to have with us Dr. Ali Abdullah, a clinical pharmacist, to discuss some important points regarding medications and certain misusing, but right after this short break.
Treatments are constantly evolving, thanks to research and development in the field of medicine. Researchers work tirelessly to develop new and innovative treatments to improve the health and well-being of patients. While medical treatments can be incredibly beneficial, they can also be misused. Misusing medication, whether by taking too much or not enough, can be serious consequences. It's important to use these treatments responsibly and as directed by medical professionals. Patients should never share their medication with others or use medication prescribed for someone else. While medical treatments can be highly beneficial, it's important to use them responsibly. Misusing medication or other treatments can lead to harmful side effects. Medical professionals are there to guide patients on the proper use of treatments and to monitor their progress to ensure optimal results. Alternative medicine is an increasingly popular option for those seeking a more natural approach to treatment. Alternative medicine encompasses a wide range of practices such as acupuncture, diet, or herbal medicine. While some alternative treatment may be effective, it's important to note that they may have undergone the same rigorous testing and traditional medical treatments. Medical treatments play a critical role in our healthcare system. However, it's important to use treatments responsibly and to consult with medical professionals before trying any new treatment, whether it's traditional or alternative medicine.
We're happy to have with us Dr. Ali Abdullah, a clinical pharmacist, in the studio to discuss more about this main important issue. Dr. Ali, welcome to the program.
Welcome, Dr. Mohammed. Thank you for the great introduction, and I would like to say hi to the audience and the viewers.
Thank you so much. Okay, I'm going to start talking about this main event that just happened, which is the DOVAT convention, which happened in Dubai. Could you please tell us more about it?
Yes, before a few days we went as a pharmacist to participate in DOVAT, which is the International Dubai Pharmaceutical and Technology Exhibition. It does have two parts. One of the parts is one of the largest exhibitions they have in the Middle East, probably the second or the third in the world. And the other important part is the lectures and the workshop parts. And in the lectures and the workshop parts, we had more than 140 speakers, more than 1,000 workshops, and also we have more than 1,000 exhibitors in the exhibition. And the good thing that happened this year is we had the largest number of speakers coming from Kuwait, which was around 10 to 12 speakers from were Kuwaiti pharmacists. They have introduced the latest updates in the pharmaceutical information and the pharmaceutical updates. And there were some workshops that the pharmacists have attended as well.
Okay, that's great. That's great. That's actually quite involved in a big scale, as you mentioned.
Yeah.
But in general, how is the Kuwait pharmaceutical community is keeping up with the new trends happening in the field?
Well, I should proudly say that the Ministry of Health are giving us the full support to keep us updated with the latest information and technology in pharmacy. So the pharmacists are working on themselves to improve their knowledge, to keep up with the information that just have, let's say, being updated in the field. So they are keeping up with all the conferences around the world. We have DOFAT, which is, as I said, the most important conference in the Middle East, and we have the other one, which is FIB, which is organized by the International Federation of Pharmacy. We do have some different workshops that happens every year. This helps us and gives us the chance to improve ourselves and improve our knowledge, and this in turn can be applied in the Kuwaiti health sector, so we can also give the full service to the patients.
Interesting. Now, in your opinion, how important is it to participate in such big events?
Well, as we all know as medical professionals, that the medical knowledge is constantly changing year by year. So I think we need to meet up with the experts in these fields, either in the pharmacy or in the medicine or even in dentistry. So you need to meet up with the experts, those people who have made like studies, they have made their own experiments. They will give you, they can transfer you their knowledge, and then you can also, as I said before, you can move it on to our country, and then we apply to the patients to give the most optimum services.
Absolutely. And I want to ask you about something that's trending right now, which is the weight loss injections. There has been a lot of talk about this. Could you explain to our viewers what are they and what's so significant about it?
Well, I have to say that, you know, in the last decade or the 2 decades, one of the biggest problems to the medical professionals was the obesity. So scientists were trying to find any way to treat the obesity, as we know that the obesity may come up with other complications that might affect the patient. So they started with having some sort of surgeries, which we call the bariatric surgeries. So they started with the bypass surgery, with the sleeve surgeries, as you know, and then as we always mention that the knowledge and the information is constantly changing, so they try to make studies on some drugs, or let's say some medicines. They started to have different studies on medicines that were designed to treat diabetes. But at the end of these studies, they found that those people who were participating as subjects for the study, they have lost their weight. So they tried to find out whether these drugs are effective in weight loss or not, and they found that it is very effective in losing weight.
So originally it was designed for treating diabetes?
Yes, definitely. It was originally for treating diabetes, but at the end of the studies they found that there is a massive weight loss, so that's why they decided to move on to other kind of studies to find if it's effective in treating obesity or not.
Okay, now without getting into much details, I'm sure it's going to be a very complex subject to discuss, but how do they work?
Well, there are so different types of medicines that treat obesity, starting from before 10 years, let's say. They first started with some medicines to prevent the absorption of fat that is coming from the food, but at that time they were not so effective in losing weight. And then they, after we say that they started the studies on the diabetes treatment, they found that these drugs can help the patients to have 3 different actions. The first action is to slow the gastric emptying, or the speed of food emptying from the stomach, so the patient can feel he's fulfilled, he doesn't want to eat anymore. And the other one is to give an indication or information to the brain that I'm feeling full, I'm not starving anymore, so he can eat less. And the third one is to increase the insulin secretion inside the body, so they can break down the sugar levels or the blood sugars.
So there is a different mechanism for each drug?
Yes, basically. And actually I have to say that these kind of drugs, they are already being secreted inside the body. So after you have like a meal, you will have one sort of hormone that gives you these 3 actions. So the scientists tried to have this hormone and then try to make it as a medicine.
As with any drug, I'm sure there has been, it's very tempting to misuse some of these medication.
Well, they do have a good safety profile, as we say as a pharmacist. But however, some people may, as you stated, that they misuse it. Especially there are certain indication that has found in the studies. Let's say one of the most important indication is the BMI, which is the body mass index. So some people might have might not have the indicated BMI, and then they decide as well to use it without any doctor or professional consultation, or without having the proper consultation before starting. So this is what we normally don't recommend for the patients. We always ask the patient to ask for an opinion of a professional before starting any medicine. So for these medicines, you need to do certain tests, blood test or something, and to have the patient history before starting. And it is always recommended that you don't have to take the medicine if you are not indicated to use.
That's interesting. We're going to talk more about this, but we have to take a short break. Stay with us, please. In the studio, we're still talking to Dr. Ali Abdullah, a clinical pharmacist. Dr. Ali, before the break, we were talking about the weight loss medication, or the injections we were talking about. And we were talking about the different mechanism, that each one has a different mechanism that's been utilized, and we also discussed about the chances of misusing some of these medications. But I think the main question is, are there any side effects for these medications?
There is no medication that comes without a side effect. That's a general rule for us in the pharmacy. So every medicine, even though if it's very safe to be used, however, there should be some minor side effects. So even for these drugs, as per the studies that have been made, one study is the STIB study and the other is a SURMOUNT study. It does have shown some very common side effects, like the gastric distress. As we can say, it's the diarrhea or the nausea or the vomiting. That's very common between the users. And the very minor ones that the patient have is some sort of pancreatitis, some complication that might happen to the thyroid gland as well. So that's why we always recommend the patient to follow up with a patient or with a medical professional. Either ask a doctor or a pharmacist if they suffer from any side effect.
To minimize any side effects, basically. Now, other than diet and exercise, is there any other ways or methods of losing weight?
Well, in this time, I think patients would prefer the medicines as an aid for losing weight, probably because they are more convenient to use, so they can use it at any time. Some people may try to change their lifestyle. They stick to a certain diet to lose their weight, but even in the studies, I think the results comparing the use of the medicine and changing the lifestyle was very comparative, and there was so many significant numbers showing that using the medicine would be better with some type of patients, not everyone. We have the invasive ways of losing weight, which are the surgeries, and that would need a certain follow-up with the surgeon. It may also need certain ways of keeping the site of the surgery safe and clean to avoid the infection. There are so many ways to help the patient, but that always depending on the patient's state. If he's having like a certain BMI above 35 or less than 35, if there is any comorbidities, if the patient is willing to stick to a diet or something.
Absolutely. But I mean, in terms of the effectiveness of these medications?
Well, in the effectiveness, as we say in the studies, they have proved that the effectiveness of the surgeries would be the must. The medication would be the second, and the lifestyle would be the best and comes third as well. Absolutely. We always try to keep out the patient away from the operation theater, or either from using medicines or chemicals. But if the patient doesn't have any other way, then we can recommend medicine or surgery.
Exactly. Now, in your opinion, what is the most commonly abused or misused drugs?
Well, that's a very wide area to speak because
depends on what you want.
Yes,
basically.
Depends on what. I think we have some, let's say, some mistakes that happens with the patients. Some we have inherited from our parents. Some medicines they keep in different places that are not recommended to keep with. As example, the antibiotics, they keep the bottles open in the fridge and then they can recommend it to anyone. We always recommend the patient or ask the patient not to give your medicine to anyone, even if they have the same indication. That's why we ask the patient. Now, with the easy access to the medical information or to the medical professionals, you can get the information you want very easily comparing to before, let's say before last decade or last 10 years. Now, there are some mistakes in keeping the medicines in different places. There are some recommendation for each different medicine. The use of some certain medicines, such as the eye drops, it has to be restricted to avoid infection. Don't share any injection with any other patient. just to try to avoid the transmission of diseases or something. So it's a very long way to speak about the mistakes.
It's a very long list, but I would assume, I'm sure you agree with me, that recently the issue with the opioid, basically the pain medications, is I would assume would be the most commonly abused or misused
it is a
line
social
of medication.
Problem. Yeah, it is a social problem we have with the misuse of some types of drugs, such as, let's say, opioids or any other things. So again, let's say if you find any medicine or anybody recommend you a medicine, don't listen to anyone if he is not a medical professional.
Exactly.
So you need to get the advice from specific persons.
Do you think also mislabeling the medications at the house or anywhere else could be considered type of misusing?
Yeah, sure. Even like if you go to like a pharmacy or somewhere, sometimes you can give a false indication, which in turn the pharmacist may give you a wrong medication for the indication you have said, while you don't have. That's why you need to check up with the doctors before deciding what medication you have. Sometimes some people at home, they don't keep their medicines, as example, away from the children. So if they keep it in an easily accessible places, the children might go to take it as well.
Yeah, the location of
if there is a wrong, sometimes if the medicine is dispensed in the right way from a clinic or somewhere, it might have an indication for something, and then the user might take it for another indication which is not even indicated.
Yeah, exactly. And not to mention the shelf life and the expiration date.
The expiration date,
and the environment they are kept in.
The storage condition as well play a key role in having the medicine in a safe way.
So is what I'm trying to say is the word misuse, it does not just mean the misuse by intaking, by even the whole process.
You came up in my mind with one very important point as we are speaking about the GLPs or the weight loss medication. Sometimes the people, they don't go to the designated area to buy the medication. In the social media, some people, they might sell these medicines, so some people might go to take it from there or buy it from there, and we don't even know if they are following the good regulation of storage, as we said, because these medicines need to be stored in a very special way, like in the fridge or something. So you don't even know if you are buying from someone that he is not a professional, is not a pharmacy, is not following the ministry regulations.
It's not authorized.
That's one of the misuses as well.
Exactly. Yeah. So if there is any last word you want to leave us with?
Well, I was so glad being with you. Sorry if I'm having a very long time.
It's fine.
And actually, I'm so honored to be a part of this program as well.
Thank you so much. I wish we had enough more time so we can discuss more about this main important issue, and especially the field of clinical pharmacist, because I know it's a very important, it's a very new field, and it's a big key in the healthcare system, especially the new healthcare system. But hopefully we will have you again with us in the program in the near future.
Absolutely.
Thank you so much for your time.
Thank you very much.
Thank you very much. Dear viewers, we will still have more interesting reports, but after this short break.
A drug is a chemical or biological substance that affects the body and its functions. Drug absorption is when a drug enters the bloodstream. The level of absorption can affect the speed and the quantity of the drug at the site of action. This is termed bioavailability. If a tablet releases the drug quickly, blood levels may become too high, whereas slow release may result in low levels of absorption. Additional factors affecting absorption and bioavailability include the properties of the drug and the physiology of the person, such as pH levels in the stomach and its speed of emptying. Therefore, specific formulations are used to release the drug at the desired speed. Common formulations include tablets, capsules, suppositories, transdermal patches, and solutions. Drug metabolism is the process by which the body breaks down drugs, which mainly occurs by means of enzymes located in the liver. Many factors, including intake of specific foods and other drugs, can increase or decrease the speed at which drugs are broken down, and thus determine their levels within the blood. A drug may be broken down to stop it from working. However, there are other drugs that need to be broken down or modified before they become active. These are known as prodrugs. Some drugs are directly eliminated from the body by the kidneys in urine. For this to happen, the drug must be water-soluble. Drugs that are not water-soluble may be metabolized by the liver or enzymes in the blood into breakdown products that can be eliminated in urine. Diseases that affect the liver or the kidneys can cause blood levels of a drug to increase.
Physical activity can play a vital role in preventing and managing many chronic diseases. In some cases, regular exercise can be an effective replacement for traditional medicine, as it can help to improve overall health and well-being without the use of pharmaceuticals. However, it is important to consult with the doctor before making any changes to medications or treatment plans, as physical activity should be used with appropriate medical care, but not as a replacement. For now, let's watch the report about some physical activities tips, so stay with us.
Hello everyone, this is Fawaz. Today, I'm gonna talk about why it's a must to lift weight. So a lot of people think cardio, it's more than enough. Unfortunately, no, it's not enough. You should lift weight for so many reasons other than looking good. So first of all, you're gonna gain strength. So who doesn't like to be strong? Second thing is gonna build muscle, which is gonna lead to burn extra calories if you are cutting weight or losing weight. So it's gonna boost up your metabolism. It's gonna increase your testosterone level. You're gonna sleep better at night, and you're gonna gain bone density. Last but not least, it's gonna give you a good posture. So for you, if you don't have a gym or you are hesitating to go towards any gym, you can do some workout at home. So today, all what you're gonna need, it's only a couple of dumbbells. Or if you don't have any dumbbells, you can bring 2 bottles, water bottles, at least it's 1 kilogram. So we're gonna go with 1 kilogram. You're gonna tell me it's not enough. That's why today we're gonna play with the tempo, or what we call it, negative sets. So first one, we're gonna go with the biceps curls. Here's gonna be the start point. Always, you're gonna full extended arm downstairs. It's gonna be under arm position. So we're gonna hold it, you're gonna bring it all the way up towards your chest. Then you're gonna go again downstairs towards the starting point. You're gonna count until 4. So if you are on the chest level, you're gonna drop it 1, 2, 3, and 4. Then you're gonna repeat it all over. So here, the next workout, we call it shoulder press. All the way, you're gonna go full extended arm all above your head, but make sure always the start point, your thumbs towards your ear. And make sure your elbows don't open it that much. Keep it beside your chin all the time, and you're gonna press it all over. Then you're gonna count from upstairs going downstairs until 4. This is why we call it tempo. Moving on to the third workout, we call it a chest press. You're gonna drop on the ground, you're gonna lay down. Make sure what pushes the weight is your shoulder blade. So the elbow is 30 degrees towards your chest. You're gonna bring it all over, squeeze it on the top. You need to feel your chest over there. Then you're gonna go back again, tempo. So last but not least, we're gonna go with the back row. Here, you're gonna hinge your body forward, and there is a soft bend on your knee. Make sure always your shoulder blade is back, fully extended in strength back. Then you're gonna hold and bring the dumbbell towards your hips. Back then, you're gonna go downstairs and count until 4. So now you know the benefits of lifting weights. No excuses. Go to the nearest gym or start at your place to prevent you from the injuries and to be strong.
Enjoyed it, and we would like to leave you with one message, is that don't ever use any medication without the consulting with your doctor and your pharmacist. Until we see you again, stay safe and stay healthy.